And the growing coronavirus outbreak is unnerving for adults and even more so for children. So how should parents put their children at ease? Dr. Scott Needle is a pediatrician and chief medical officer of Elica Health Centers. He's also a member of the Council on Disaster Preparedness at the American Academy of Pediatrics. Thanks so much for joining us today, Doctor.
Thank you. Good day.
Thank you. So how do parents start a conversation with their kids in regards to this outbreak? For example, I have a 5-year-old at home, a newborn, but she doesn't understand this at all, luckily.
Well, everyone is going to have questions. Adults are having questions. Kids are having questions as well. So many kids are going to their parents and going to other people and asking, what is happening with this? What is the coronavirus? What can we do? And if your child is doing that, that's wonderful. Talk to them, be honest. If they're not coming forward with that, don't assume that they don't have the questions, though. Go ahead and ask them yourself. Ask, what have you heard about the virus? Are you concerned? How is this making you feel? And take the conversation from there.
What should parents make sure to reinforce with their children? Is it to keep their hands clean, to stay away from sick people, or what else would you say?
I think those are very good steps there. Just like we're telling the adults, we want to tell the kids as well. Here's something that you can do to keep yourself safe, to keep your family safe. And kids of all ages understand, and they can be taught how to wash their hands the way the CDC and the World Health Organization are recommending, to do it well, to take the time to do it, to sing the ABC song, to sing the alphabet song while you do it, and cover all the surfaces there. And then after you do that, don't touch your eyes, your nose, your mouth. These are the things that we want everyone to be doing here. It's important to reassure the kids and to say, yeah, there are things that you can do to be safe. And beyond that, to let them know what other people are doing as well. Let them know that scientists and experts are looking at medications and treatments for people who do get sick and finding the best ways to keep everyone from getting the virus.
Now, we all know that some schools have had to shut down temporarily while students get tested, or perhaps the facility has to get cleaned. How do you recommend handling that topic if perhaps they're concerned if their school is going to close?
I think it's important to, first of all, be honest with kids and let them know, yes, this may happen. Get the kids involved and start seeing how they can be ready if in case the schools do shut down. Maybe parents want to go to the store and buy a few activities, arts and crafts things, these sorts of things. It's important for also parents to be in touch with the schools or the child care centers. Make sure you have a good source of communication, good communication line, so that you can be updated when the schools give these sorts of updates here. It's important to reassure the kids, keep them in the loop on the information. Obviously, you don't want to overwhelm them, but on the other hand, you don't want to hide the information. You want to be upfront and honest with them and say, yes, this is what your school is doing. This is what may happen over the next few weeks.
Now, be open with them, but at the same time, is there a topic that perhaps parents should avoid?
Well, I think it's important to, first of all, keep that conversation going. I think if parents try and avoid the topic, they give the kids the impression that, no, this is too scary, this is not for kids to talk about. Kids are going to feel that. They're going to feel much more upset than they would be otherwise. So keeping the conversation and being honest and upfront with them is important. Also, it's important to validate how kids are feeling. If a child says, I'm worried, I'm scared about what's going to happen, we're not doing them a service by just shutting down that conversation or saying, no, don't feel like that. It's perfectly reasonable to be concerned with everything that's going on, and then to talk to them about that. Say, okay, well, let's talk about why you are feeling concerned or why you're feeling scared and how I can reassure you to help you feel confident that people are doing good things with this.
Life keeps on going on a daily basis, but should parents be fearful of taking their children to places with large crowds? I mean, spring break is right around the corner for many schools.
It's a very tough decision right now, and we're experiencing that in our health center. We're trying to take our guidance from the public health officials, from our county, from our state, and we're waiting for them. Certainly, we're telling parents, don't take any unnecessary risks. If you know you're going to be in a place where there's likely to be sick people, it's best not to go there. Kids aren't being affected nearly as much as adults, which is one silver lining that we're seeing with this virus so far, but all the same, we don't want kids to get sick. We don't want the kids picking up the illness and giving it to other people who may be more vulnerable here. As far as the public gatherings, again, we're taking our cues from Public Health Department and waiting for their instruction, and I would recommend that parents do the same thing as well.
Well, thank you so much, Dr. Scott Needle, for all your advice and for helping parents be a little more at ease. Have a great day and take care.
You too. Thank you.
Thank you.